Social workers generally self-select into palliative care. They enjoy being part of the multidisciplinary team. They are, of course, professionally trained with at least a 4-year university degree, frequently further training than that. They, as part of the team, would undertake psychosocial assessments to assist in understanding what are the special emotional needs and psychological needs of both the person who is ill and the rest of the family, including the partner and children. And they do quite important advocacy work on behalf of the family members at times with other people in the community.
Much of our role and my role is to help people with their coping abilities when they are faced with a life stress or it's a transitional stage that they are dealing with. People usually solve their problems in two ways, emotional strategies and problem-solving strategies in a practical way. And so that's where a lot of my role would be involved, in addressing the emotional coping strategies and assisting them in practical ways.
Yes, I think there's two kinds of people. There's people who may be estranged from their family, and when people are estranged from their family, then part of our role can be to help them re-establish those links, especially if they're seriously ill. And if they have lost their family and they're living alone, if they're new to the country or even if they've lived here for a long time, they can find at the end of life that they are quite socially isolated. Then we would try to talk early on about just how they might be going to manage in the months ahead. And that might require thinking about alternative places to live other than at home.
The extent to which social workers are called upon in a palliative care setting, it does vary depending on the client and family situation. It may be initially that they need that time on their own to integrate a life-threatening condition, but as the illness progresses, issues may present along the trajectory of that illness, and it may be that they need to tap into a social worker or be referred by another of the multi-D team members to a social worker for assistance with practical help or emotional support in helping them cope on the journey that they're on.
And it's certainly that varies around Australia. In the rural setting, social workers might have, for instance, a different role to the one that they perform in the inner city area of one of the big cities, and it depends a bit on the size of the team. And as Penn said, it depends finally and really most of all on just what the needs of the families might be at any point in time, and that will vary. And people may not know at the beginning just what's ahead, and we're there. I think we can offer trust and experience and an unconditional regard for the human situation.